Prevention of Nipah virus. Controlling Nipah virus in pigs. Currently, there are no vaccines available against Nipah virus. Based on the experience gained during the outbreak of Nipah involving pig farms in 1999, routine and thorough cleaning and disinfection of pig farms with appropriate detergents may be effective in preventing infection. If an outbreak is suspected, the animal premises should be quarantined immediately. Culling of infected animals, with close supervision of burial or incineration of carcasses, may be necessary to reduce the risk of transmission to people. Restricting or banning the movement of animals from infected farms to other areas can reduce the spread of the disease. As Nipah virus outbreaks have involved pigs and/or fruit bats, establishing an animal health/wildlife surveillance system, using a One Health approach, to detect Nipah cases is essential in providing early warning for veterinary and human public health authorities. Reducing the risk of infection in people. In the absence of a vaccine, the only way to reduce or prevent infection in people is by raising awareness of the risk factors and educating people about the measures they can take to reduce exposure to the Nipah virus. Public health educational messages. Reducing the risk of bat-to-human transmission. Efforts to prevent transmission should first focus on decreasing bat access to date palm sap and other fresh food products. Keeping bats away from sap collection sites with protective coverings, such as bamboo sap skirts, may be helpful. Freshly collected date palm juice should be boiled, and fruits should be thoroughly washed and peeled before consumption. Fruits with sign of bat bites should be discarded. Reducing the risk of animal-to-human transmission. Gloves and other protective clothing should be worn while handling sick animals or their tissues, and during slaughtering and culling procedures. As much as possible, people should avoid being in contact with infected pigs. In endemic areas, when establishing new pig farms, considerations should be given to presence of fruit bats in the area, and in general, pig feed and pig sheds should be protected against bats when feasible. Reducing the risk of human-to-human transmission. Close unprotected physical contact with Nipah virus infected people should be avoided. Regular hand washing should be carried out after caring for or visiting sick people. Controlling infection in healthcare. Healthcare workers caring for patients with suspected or confirmed infection, or handling specimens from them, should implement standard infection control precautions at all times. As human-to-human transmission has been reported, in particular in healthcare settings, contact and droplet precautions should be used in addition to standard precautions. Airborne precautions may be required in certain circumstances. Samples taken from people and animals with suspected Nipah virus infection should be handled by trained staff working in suitably equipped laboratories. Subscribe our YouTube channel to get more medical information.